Brain death is the complete loss of brain function, including involuntary activity necessary to sustain life. It differs from persistent vegetative state, in which the person is alive and some autonomic functions remain. It is also distinct from an ordinary coma, whether induced medically or caused by injury and/or illness, even if it is very deep, as long as some brain and bodily activity and function remain. And it is also not the same as the condition locked-in syndrome. A differential diagnosis can medically distinguish these differing conditions. Brain death is used as an indicator of legal death in many jurisdictions. But it is defined inconsistently and often confused by the public. Various parts of the brain may keep functioning when others do not anymore. And the term, brain death, has been used to refer to various combinations. For example, although one major medical dictionary considers brain death to be synonymous with cerebral death, only life support equipment would maintain ventilation. In certain countries, patients classified as brain dead may legally have their organs surgically removed for organ donation. Differences in operational definitions of death have obvious medical implications. Traditionally, both the legal and medical communities determine death through the permanent end of certain bodily functions in clinical death, especially respiration and heartbeat. With the increasing ability of the medical community to resuscitate people with no respiration, heartbeat, or other external signs of life, the need for another definition of death occurred, raising questions of legal death. This gained greater urgency with the widespread use of life support equipment and the rising capabilities and demand for organ transplantation. Since the 1960s, laws governing the determination of death have been implemented in all countries that have active organ transplantation programs. The first European country to adopt brain death as a legal definition of death was Finland in 1971, while in the United States, the state of Kansas had enacted a similar law earlier. An ad hoc committee at Harvard Medical School published a pivotal 1968 report to define irreversible coma. The Harvard criteria gradually gained consensus toward what is now known as brain death. In the wake of the 1976 Karen and Quinlan case, state legislatures in the United States moved to accept brain death as an acceptable indication of death. In 1981, a presidential commission issued a landmark report entitled Defining Death: Medical, Legal, and Ethical Issues in the Determination of Death, which rejected the higher brain approach to death in favor of a whole brain definition. This report formed the basis for the Uniform Determination of Death Act. Since enacted in 39 states, today, both the legal and medical communities in the U.S. use brain death as a legal definition of death, allowing a person to be declared legally dead even if life support equipment maintains the body's metabolic processes. In the UK, the Royal College of Physicians reported in 1995, abandoning the 1979 claim that the tests published in 1976 sufficed for the diagnosis of brain death and suggesting a new definition of death based on the irreversible loss of brainstem function alone. This new definition, the irreversible loss of the capacity for consciousness and for spontaneous breathing, and the essentially unchanged 1976 tests held to establish that state, have been adopted as a basis of death certification for organ transplant purposes in subsequent codes of practice. The Australia and New Zealand Intensive Care Society states that the determination of brain death requires that there is unresponsive coma, the absence of brainstem reflexes and the absence of respiratory center function in the clinical setting in which these findings are irreversible. In particular, there must be definite clinical or neuroimaging evidence of acute brain pathology consistent with the irreversible loss of neurological function. In Brazil, the Federal Council of Medicine revised its regulations in 2017, including a requirement for the patient to meet specific physiological prerequisites and for the physician to provide optimized care to the patient before starting the procedures for diagnosing brain death and to perform complementary tests, as well as the need for specific training for physicians who make this diagnosis. In 2020, an international panel of experts The World Brain Death Project published a guideline that provides recommendations for the minimum clinical standards for determination of brain death, death by neurologic criteria in adults and children with clear guidance for various clinical circumstances. The recommendations have widespread international society endorsement and can serve to guide professional societies and countries in the revision or development of protocols and procedures for determination of brain death, death by neurolog.